we're going to talk a little bit more about this because we talked about how deadly this disease can be. Dr. Alberto Colomer is a pulmonologist with St. Luke's Episcopal Hospital, and a patient, 68-year-old Gregory Gregg, joins us now to talk more about this. Welcome to you both this morning.
Thank you for having us.
And we find this very important to talk about because it really isn't something that you hear about a whole lot. So let's first of all start with you, Gregory, and talk about how COPD affects your life.
Well, the COPD I have is emphysema, which was a result of 53 years of smoking heavily and then getting very short of breath and coughing a lot and things of that nature, and finally showed up at the pulmonary doctors to diagnose. They diagnosed emphysema and put me on a series of medications, mostly inhalers, and I've been on those since 2004, and 100% different. They're just wonderful drugs out there today.
Dr. Colomer, when you see a patient like this, what is the typical treatment process that you put them through?
So the first thing we do when we see a patient like this is trying to find out why they're short of breath. The main complaint or symptom they come to is just, I can't do what I usually used to do. And that gets prolonged for years sometimes before they come for help, and it's usually when somebody else points them into care. So usually we get a simple breathing test called spirometry, where we measure flows of air. And then we start working on anti-inflammatory medications and medications that help relax those airways so that the lungs can actually get air in and out very simply.
And medications have helped your quality of life?
Oh, absolutely. Absolutely, 100%. I mean, compared to what it was before I went in.
And what type of medication are we talking about? Are these pills that you take, or is
no, these are just inhalers, spray inhalers that, in my particular case with emphysema, they've just worked wonderfully. I've gone from 30% of lung capacity up to 50% of lung capacity, other than maybe not being able to go to Aspen and snow skiing anymore and getting up in the altitudes. My daily lifestyle is today pretty much 80% to 100% normal.
And that is so good to hear, that there is help, that they are able to get help. But when we talk about how deadly it can be, is that because patients aren't getting the help that they need, or what's happening there?
So the main reasons why it's so deadly is because first it gets diagnosed very late. So COPD is something that's very preventable because it's 90% attributed to smoking. And the problem is it gets diagnosed so late into the course that people have significantly lung damage by that time. And a lot of times they're near the point where they need oxygen therapy, and they already have all the cardiovascular effects. So it's really a matter of diagnosing early, stopping smoking, and then being really compliant with a reduction of inflammation to the lung.
Well, we appreciate you coming in to talk more about this because, again, I think that it is an understated disease. Gregory, great to talk to you. We appreciate you sharing that story with us and your personal life of how I hope you can help others realize they need to get seen quickly.
Well, I just have one bit of advice. If you're a smoker, quit.
There you go.
That's the best medication you could take, period.
Dr. Colomer.
My advice is...
that will probably be your advice as well, right?
Yeah, absolutely. Stop smoking. Only a third of patients that try actually stay without smoking, so be very consistent. Talk to your doctor. Make sure you're part of that as a team. Don't try to do it on your own because it's really hard.
All right. Well, thanks for coming in for St. Luke's. We know you're a busy guy.
Thank you.